Hi there. We want to speak briefly to you about 5 key things that people need to know when it comes to supporting people with intellectual and developmental disabilities during this time of COVID-19. My name is Yona Lunsky, and I direct the Healthcare Access Research and Developmental Disabilities Program at the Azrieli Adult Neurodevelopmental Center here at CAMH in Toronto. And I'm going to be joined by Dr. Liz Grier, who is a family physician at Queen's University and the medical director at Ongwanada, which is a community-based service for people with developmental disabilities in Kingston, Ontario. And this work was also developed with our colleagues, Dr. Bill Sullivan, who's a family physician at St. Michael's and at Surrey Place Center, who also directs the Developmental Disabilities Primary Care Program and is the lead author of our national guidelines for adults with developmental disabilities and their primary care, as well as Dr. Ian Casson, who is on faculty at Queen's University and a family physician and the head of the special interest group for the Royal College of Family Physicians of Canada. We don't have any financial relationships to disclose or conflicts of interest with regard to this brief presentation. I wanted to take a moment before we talk about these 5 essential issues that we want people to keep at the top of their minds about who it is that we're speaking about when we say intellectual and developmental disabilities. And first, there's a photo of 5 fantastic people who I get to work with developmental disabilities. And what you notice in this photo, of course, is that they don't all look the same. They come in all ages, shapes, and sizes, as do all of us. Some developmental disabilities like Down syndrome are easily recognizable. Other developmental disabilities, such as autism, for example, can have a range of etiologies, and you may or may not know by seeing the person that the disability is present. We know that people with developmental disabilities here in Ontario and most parts of Canada are living in our communities alone with their families, in group home or congregate, larger settings with other individuals with developmental disabilities. And they have a range of healthcare issues that they deal with in their lives. This infographic at the bottom of the slide is a quick illustration of what we know from the sort of population level here in Ontario of what happens in terms of healthcare use and this group. And what I want to highlight here is that in many areas when it comes to emergency use, hospitalization, being stuck in hospital after being ready for discharge, and perhaps most important, premature mortality, this group is at much greater risk for having these things happen to them than other individuals. And it's important to keep in mind, this is not strictly because they have developmental disabilities, but it's also about how their healthcare issues, their communication skills, and also how our community responds and supports them day to day interact with each other. So there are many issues for this group when it comes to getting the right kind of healthcare at the right time, as well as many social determinants of health that impact them in terms of poverty, not being employed, and not being well supported, that can lead to many healthcare issues. But this is important because this is a group who is very much at risk for having healthcare issues and for coming into our hospitals, and we need to think about how we can support them during this time of COVID as best we can. Just to give you 2 examples of the kinds of things that come up and the things we need to be thinking about. Imagine someone in his 40s with Down syndrome showing early signs of dementia, living in a group home who's developed a dry cough and mild fever. Now this man has several roommates living in the home with him, and he also has many staff who support him just to keep him oriented day to day. And with the loss of many of his routines and things that he's doing at home, it's that much more difficult for him to manage. And now he's showing symptoms that are, potentially consistent with COVID. And he needs to get tested, but he gets tested, and imagine that he doesn't actually know what the results of the test are, and neither do his staff. And so now the group home is required to be doing self-isolation for him, for the other people that he lives with, and not only for those few staff who are working on a daily basis, but it actually ends up being a number of staff who are actually working as well in other homes. So suddenly, this group of people is not able to work, and there are shortages of staff. Everyone is getting quite frustrated in terms of how to manage, and because we still don't know what the outcome of that testing is, there's sort of long isolation, even going into 9-10 days, still not knowing really what's going on. In another situation, you can imagine a young woman who has more of a mild disability living with her mom, who's older and has several health risks that put her at risk for COVID-related illnesses in a small apartment setting. And it's really hard for her to adjust to the changes that have happened, and she wants to be able to go out, do her routine, see her friends, and she finds out that she could go to someone's house on the other side of the city who's offering an exercise class because her usual exercise classes are ended and she's not allowed to go. So she takes money from her mom and goes out, even though her mom is concerned about it, to join this group of people to participate in an exercise class and hang out with friends, which is both putting her at risk again, not being able to follow the sort of physical distancing rules, but also her concerned mom.
So thank you, Yona, for that very helpful introduction here. I would just like to provide some medical background around the risks for adults with IDD and COVID-19. This group is at increased risk of contracting COVID. Many adults with IDD live in congregate settings and rely on caregivers for their basic needs, things like showering or being transferred to a wheelchair that result in frequent close contact with others. Many adults with IDD have difficulty understanding and difficulty coping with preventative measures like self-isolation and managing some of the self-hygiene measures that are recommended. And then importantly, many adults with IDD, if they are not verbal, have difficulty with the self-monitoring recommendations in the inability to report subtle early signs of COVID, such as a new sore throat, a headache, or fatigue. These are subjective symptoms that are difficult to be able to report for them. This emphasizes the importance right now of having their temperatures taken twice a day and monitoring patients, for example, who may have a chronic cough for any subtle signs that we may recognize consistent with new respiratory illness. This group is also, if they should contract COVID, they are at risk of more severe illness with COVID. This is in part because of a high rate of comorbidities for this population, particularly respiratory issues. At least 40% of people with IDD die from respiratory illness, and so their risk with COVID is higher. This group is also known to have higher rates of heart disease and diabetes, which are other important comorbidities. Lastly, we understand that adults with IDD have high rates of premature aging. Studies have shown that levels of frailty that we would see in a 50-year-old with IDD are equivalent to those we would see in an 80-year-old in the general population. Finally, this group is at increased risk of emergency department visits or hospitalization for non-COVID issues during this time. And of course, we are trying to reduce traffic to the hospital as much as possible in order to cope with COVID in our communities. The COVID restrictions that have been put in place that result in inability to access day programming or regular routines, the staff shortages that have resulted from people needing to be off work and in self-isolation can cause destabilization, which increases the risk of hospitalization for physical health or mental health issues. It is very important that there be good access for frontline care providers in group homes to their family physician or psychiatrist to be able to access telehealth or mental health crisis lines during this time to prevent emergency department visits and hospitalizations. Next slide, please. So we'll start now with our 5 key messages. Our first key message is to understand that some adults with IDD live in congregate care, and they have similar medical and behavioral concerns to many long-term care residents despite their younger age. Public health guidelines should provide for expedited assessment, i.e. testing, and enhanced follow-up for this group in keeping with considerations around outbreak precautions that are put in place for long-term care. Next slide, please. Our second key message, the direct care workers in group homes for adults with IDD, many of whom work across several homes in order to maintain adequate 24/7 staffing, are essential to their health care. They must be considered in the same way that we are considering essential healthcare providers at this time, again, in order to keep our patients stable and out of hospital and to contain a COVID outbreak should it occur to our maximum capacity. The protocols and protections like those for essential healthcare workers should therefore be implemented.
Our third key message is concerning that group of adults who have more mild intellectual disabilities, who are living independently in the community, and it can be very difficult for them sometimes to be able to either understand or without supports in place, adhere to the current public health guidelines. So it's essential that we have proactive communication and support, and this can be virtual. It can be either by phone or texting or through video conferencing, coming from knowledgeable social and healthcare providers to help them adhere to those guidelines to keep themselves safe and other people safe, and to really manage the distress they're experiencing during this confusing and difficult time for them. Our fourth key message concerns family caregivers, especially those older parents who are living and providing care for an adult with an intellectual or developmental disability. We know that not only are those adults they're supporting potentially at greater risk because of their health care and health issues, but those parents can also be at risk for severe COVID-related illness. So we need to have crisis plans in place so that if there is a situation where either member of that family becomes very ill, we have ways to support that entire family, regardless of what takes place. And our final key message speaks really to what happens in hospital. If an adult with an intellectual or developmental disability does need to go to the emergency department or hospitalization, this close partnership around the clock 24/7 is critical between the community supporters and providers and the hospital. The hospital staff need to listen to that patient, however they're going to communicate their needs, but also family or other caregivers to best understand how that person communicates, to be able to recognize and monitor symptoms, and to make adaptations to other special needs that they have. Decision-making supports and advanced care plans are crucial at this time. And we also need to make sure that if there is a substitute decision maker required for some healthcare decisions, that we're aware of who that person is and that they're accessible to that healthcare team in hospital at all times. There are many resources coming out from around the world right now, really focusing on how to best support people with a range of disabilities, including these intellectual or developmental disabilities. So this last slide just includes some links to some key resources from the World Health Organization. The second link from the NHS is specific to all healthcare providers supporting people with intellectual and developmental disabilities. Our primary care guidelines and many tools to help us with providing healthcare to people in adulthood with developmental disabilities can be found on the Surrey Place website. And then patient and family-oriented resources to help understand many of these issues can be found on our HCARDD COVID page. Thank you for listening to this presentation.